of encouraging numbers from state health officials. Only 422 new cases of the coronavirus were reported yesterday. We should point out the testing was also low, less than 5,000 tests, but less than 9% of them were positive, so that's a good trend. Sadly, 57 more people lost their lives, bringing the number of deaths in our state to 6,473. Now, each day we've been giving you the number of cases, the number of deaths, and the number of hospitalizations. But where are we when it comes to flattening our coronavirus curve? Well, you can see our curve here from the beginning of the outbreak in the state until this week, and it's definitely trending down. WBZ's Paul Burton is live in Boston for us tonight. And Paul, the governor himself says we are making good progress here.
Yes, and both the governor and health experts say just because we're seeing signs of improvements doesn't mean the threat has gone away. We must remain vigilant and know that a second wave will most likely come. But how bad it gets is up to us.
And we've talked a lot about preparing for and dealing with the surge, which is now something that, thanks to a lot of work by a lot of people, is behind us.
As the state slowly begins to reopen and people return to work, state and health officials say the surge is over, and they are hopeful that there will not be a significant second wave of the virus in Massachusetts, thanks to face coverings, social distancing, and a gradual opening of society.
All of those things make me cautiously hopeful that we will not see a significant wave here in Massachusetts.
However, without a vaccine, health experts say the coronavirus could be with us for many months and possibly into the next year. Dr. Paul Biddinger, director of the Center of Disaster Medicine at Mass General Hospital, said fewer restrictions there are on openings, the greater chance there is of a second wave.
There's always the risk of another wave. Unfortunately, of course, the virus hasn't gone away, and we don't have any preventive measures.
There are currently just over 2,000 people still hospitalized with COVID-19, which is a significant decrease over the past few weeks. And there is reason to believe that a second wave won't be as devastating in the region.
I think the chance of a second wave is pretty significant. Hopefully we'll keep that wave small. We have to decrease the opportunity for the virus to be transmitted from person to person. So just because we're seeing improvement does not mean that the threat has gone away. We have to be vigilant.
And health officials say so much of the success of how we handle this pandemic is up to us. Face masks, hand washing, social distancing will play a major role. Live in Boston, I'm Paul Burton, WBZ News.